Just wait, it's still processing. Yes, Bijinder ji, you can start now.
Well, on a nice sunny afternoon, welcome, warm welcome to all our Asha family, our supporters, our members, and Dr. Bisham Singh and Taylor, who are giving their time to support us. Asha Australia Foundation has been and is and will be supporting our seniors so that they can live healthy, active, and happy life. We encourage them to choose the way they want to live, and we will support them, we'll be behind them. And we are very thankful to Dr. Bisham Singh and his team for supporting us. Now, back pain is a very common issue for a lot of us. And with the COVID, it has become more complex because we have decreased our activity, our physical activity, and we've been sitting and watching TV, and that can create a lot of issues. And we are very grateful to Dr. Bishop Singh, spine specialist, and Taylor to give up their time. And today is one of the very special day for us. I'm going to be not taking your time. I'll ask Dr. Sundar, who is one of our directors, to introduce Dr. Bishop Singh and Taylor, please. To you, Dr. Sundar.
Good afternoon, Asha family. Good afternoon, and Ms. Taylor, good afternoon. Thank you for coming over for Asha team, the back injury. We all know about Bishop Singh, one of the best spinal surgeons in New South Wales, I would say. He works in Bella Vista, Campbelltown, and Liverpool, and also in Sydney. You can contact him, go to Google him, Bishop Singh, you can find his places, and we'll see Asha team, he has a special interest for Asha people there. That's number one about business. He specializes in spine and neck injuries also, and all type of injuries in the spine. He will assist Taylor, the physiotherapist. We know about Taylor. He's passionate in exercise physiology to guide people through rehabilitation of an injury, all the way maintaining and enjoying active lifestyle, both after injury, prevention and aggravation, and overall quality of life. Ms. Taylor has successful lengthy career in soccer, has participated in many sporting activities, swimming, dances. You mentioned she's there, quite young and very active. And she's going to talk about how you can look after your back after sporting injuries or change your lifestyle after back injury, especially after back operation. Dr. Bishop Singh, Dr. Taylor can help you go through all the way through to normal lifestyle. I'm introducing Ms. Taylor from Bella Vista. You can Google Active Life. I can find the phone number, and you can ask our team special privilege for Asha team to see Ms. Taylor. Thank you, Ms. Taylor. You can go through now.
Thank you.
Hi, everyone. Thank you very much for the introduction. I'm an exercise physiologist. I thought I'd let you all know what that is, first of all. So an exercise physiologist specializes in active lifestyle, chronic conditions, and injuries. So we help people from healthy all the way to injury or surgery with active rehabilitation or exercise-based rehabilitation. To become an exercise physiologist, you need to do at least 4 years at university, and I think a maximum of 5 years. So I have a university degree, and so does my colleague Chris. And we work alongside the people at the spine specialists with their back pain. So Dr. Singh usually prefers to help out if there is pre-surgery, post-surgery, or if there is a non-surgical intervention. And that's more to help with lifestyle, help you function better, and hopefully reduce your pain as well. So I thought we were going to go through a few how me and Bisham work together. So Bisham, what do you usually look for when you're referring over to an exercise physiologist?
I think exercise physiology is the mainstay of treatment, I think. And of course, I see a subset of people who have been referred to a spine person, but even then, 90% of people whom I see, I ask you and Chris to see them. or to do their own exercises, because there are 2 or 3 bits you might divide it into. The most important thing is prevention, and prevention is very important to prevent a problem, which then gets you to a point where you have to come and see somebody like me. So prevention is the first and most important thing. If you do have acute back pain, most of the time, my job is to assess the back pain, to find out the probable cause of the back pain, and then hand over to you. Because we know, and you and I know very well, that most people with back pain will respond to exercise. It's only a small population of a small population who will need any intervention from somebody like me. So I think that's the first subset of people I see. There are some who have trialed other things, or if they are in a position where they probably need surgery, then again, exercise physiology becomes key, because to have an optimum result and heal very well, they need to do exercise. They need to strengthen the muscles which have not been used or are not being used because of pain. So as we know, muscle inhibition is one of the key things in an acutely painful back. And if you don't use your muscles, it doesn't support your back very well, and then you tend to become worse. So the patients who are requiring surgery, as you know, I get asked you to see them and bring them up to speed, bring them up to a point where they're as fit as they can be before surgery, so that they have a good result. And of course, post-operative rehabilitation again is key. So I think what you and Chris do is the mainstay of all treatment for back pain.
Carla, you can share the screen now.
Oh, yeah. So what I thought I would go through is some of the ways that we rehabilitate, or as Bisham said, prehabilitate when they come and see us. So I'm going to show you just if you are trying to prevent lower back pain or lower back injury, we need to do some strength exercises. So what strength exercises will do is create a robust trunk and lower body. Can you guys see my screen?
Yes.
Okay, beautiful.
Yes, we can see a screen. Thank you.
Okay, so what we try to do is strengthen the trunk, strengthen the hip and the lower body, especially for people with lower back pain or trying to prevent it. So this is Chris, my colleague, who's going to show us how to do what's called a bridge. And the bridge is strengthening the posterior chain, so the glutes and the back of the legs, and it also engages the trunk. So you can see Chris has tilted his pelvis so that his bottom is squeezing, and he's thrusting his hips in the air. So this is one of the main ones that we do. It's very, very safe, and he can just go in a range that's comfortable for him. So as soon as you start to strengthen the glutes and the regions above and below the lower back, you start to get a positive improvement in how much you can walk. You can see he's seeing if I should stop or not. How you walk, how you balance, and this will directly support the areas above. I'll show you another one, and it is a trunk exercise. So when I say trunk, this exercise is going to work the front of the trunk, so what we would usually call abdominal region. And what this will do, the muscles around the trunk wrap around to the back as well, and there are muscles that are directly attached to the spine. So this is working the global muscle groups. And for this exercise, I've put my hand underneath in my lower back where there's usually a little bit of a natural gap there. And I'm pushing down into my hand to make sure that my spine is nice and stable and flat to the floor. From there, I've lifted my legs up, and in this situation, my legs are actually weights. So you can imagine that if I don't control enough with my trunk, the weight is going to shift down the other way. So I'm using my trunk here to support my legs, and then I tap my legs to make it harder. So as soon as I'll go back again, as soon as I move my legs, it's causing more effort for the trunk muscles. So as Bisham alluded to before, as soon as we start strengthening through the trunk, the bottom, and up through the back as well, you are actually helping prevent injury because you're more ready to complete the task throughout the day. And if you do end up being injured, you are more prepared for that injury. Does anyone have any comments on that? Bisham, do you have any comments on that?
No, that's perfect. You're absolutely right. We have to engage the core muscles in the back, which go down into your glutes and your legs, and also the muscles in your tummy and the muscles which are deep in your tummy to the spine. And people, and even me, half the time don't realize that the mainstay, the usual exercises that we do or we think of or imagine don't usually target these muscles. Correct. And yeah, and we can talk about, the unfavorable and favorable degeneration of spine later. But the essential point is that if you keep these muscles strong, then they keep your spine stable. And that's the mainstay of treating your back pain. Correct.
That's exactly right. And as well, like, we obviously don't know what's going to happen in our lives, and there's only so many things we can control, and muscle strength and keeping strong bones are some things that we can control. So if you do strength training, maybe you do or don't know this, but if we do strength training, you can actually improve the bone mineral density, and this helps prevent fractures or the likelihood of fractures down the track. The muscles will support the structure as well. So these are things that we can control, which is why prevention is so important. I'll also show you, so for example, if you do end up with a little bit of a sore back, and I think everyone in their lives ends up with a sore back at some stage, right? So I've experienced it, I'm sure everyone else has as well. But sometimes it can be a bit more troublesome. Usually we just avoid it, but sometimes we need to have active coping strategies to help when the pain comes. And I think a lot of people just panic and don't know what to do, but there are a lot of active coping strategies that can be utilized. I'm going to show you two here. One is just a stretch or a nerve floss, depending on what you need. But I think I've shown a stretch here for the back of the legs. As we know, the lower back is very important in terms of how we can feel. Sorry, I'll re-say that. How the lower back is feeling, or if there's an injury to a lower back, it can actually affect the lower limbs as well. So we end up being really tight in the bottom and in the back of the legs, and that can cause even more of an issue because the muscles seize up in the area. So in this situation, what I've done, I'll rewind a little bit. I've actually bent the back leg. You can see I've bent the other leg, and what that does is it supports the spine. So your back is a little bit more flat to the floor, like that other exercise I did. The difference here is that I've used a band, or it could be a long towel, a beach towel, a rope, it really doesn't matter, to assist my leg lifting it up. So if you have something like muscle soreness, or you're feeling really tight in the back of the legs, or if you're getting those neurological symptoms that can sometimes happen when you injure your back, this will help to improve the mobility and therefore the amount of movement that you can cope with. It's very, very simple. You can do both sides, and it helps a lot more than you would expect. So that's one of them. And then the other one that we love to give, especially if you've just started to experience lower back pain, this is a really good active coping strategy. It's called a lumbar rock. And what it's doing is it's promoting movement in the lumbopelvic region. Sometimes when you get injured, you really don't want to move that area. You feel like it might stiffen you up even worse or make things worse. But as soon as you teach the body that, no, it's okay to move in that area, something like this is just going to stretch the muscle groups, reminds the lower back, if it has a mind, reminds it that it can move, and help it move a little bit more freely. Chris is just going to show us a progression here where you pop your legs up on a Swiss ball. So if you're coping with the rocking from side to side, he just can rock a little bit further here. And what you should feel here is just a gentle, gentle stretch in the lower back. So when you are just injured and you don't really know what to do, stretches are a great tool to improve the mobility in that area. And once that aggravation goes down and you can, sorry, how do I get back here? Am I back? Yeah. Once that aggravation goes down and you can cope with a little bit more active movement, that's when we would start to introduce some gentle strength exercises like I showed before, the bridges and the trunk strengthening. And all of that combined will help minimize symptoms, improve your function, and prevent a re-injury again. Does anyone have any questions about that?
I especially like the point that you have made that with these exercises, you have stabilized the spines. I think one of the things that people would worry about in the older age group would be, are they going to cause damage? But you're absolutely right. If they lie flat and they stabilize the spine, you're not really going to be causing any damage to the back because your spine is stable. And I think that's a very good point. Thank you.
May I ask a question? Is this okay for the elderly like us as well, say people above 65 years old, or is it only for the people who are injured and seeking recovery?
Definitely the exercises that I've provided are purposefully for everyone. So those are the kind of things that we give when we see someone of all ages. They're from 20 to 80. I've given those exercises and they cope really well with it as long as they understand what muscle group they need to be working and why. And especially the strength program. So the trunk exercises, the bridges, things like sit and stands, those are the things that I would be giving to every elderly person who is capable so that they can maintain their function. As you age, things like balance, walking for long periods, these become something that we need to look at and make sure that you're able to do with confidence. So those exercises are purposefully designed to improve those aspects directly. So definitely, those are things that you can do yourself.
Thank you.
Are there any other questions? Dr. Sundar's got a question.
You know, with the back pain, it's very hard to lie down on the floor, especially older people. So you need to say that you need some other person to help them out to make them lie down on the floor, do the exercise. Is that right?
Correct. So if they're struggling to ambulate and they're struggling to get to the floor, some of those ones we can do in bed. So for example, the 2 stretches that I've provided, definitely you can do in bed, you rocking from side to side and stretching the leg. If you are struggling to get to the floor for a strength exercise, I can provide ones that are for the bed. So for example, I'm not sure if you know, but like a heel slide will get the back of the legs. If you're struggling with the front of the legs, we can do a wall sit or marches, something like that. So there's always a way, whether we need to regress or progress the exercise to suit the person. And for example, that dead bug can be done in bed as well. So I have a lot of people that are not able to get to the floor, and there's always a way to strengthen appropriately so that eventually maybe they can get to the floor, eventually they can sit and stand without assistance. So those are the things that when you visit an exercise physiologist, we make a program that is so specific to you that these kinds of what you would normally think is a barrier is not even an issue.
Dinesh, do you have a question?
Yes, please. I was just wondering if for such patients who have difficulty in lying down, is there some other equivalent, maybe not exactly equivalent, something to replace doing that similar exercise while sitting on the chair or holding on to chair while standing?
Yes, definitely. So the stretch can be done on a chair for sure. The core exercise I would usually use, for example, some type of resistance band to help get the trunk working, because usually just a standing position is not enough work for the trunk. But yeah, I would use resistance bands, but the stretches can be done there and on a chair, and the legs can be strengthened in either a standing or a sitting position. So definitely the ones that I gave are just so that, you know, if you don't have any equipment and things like that, hopefully you'll be able to use them at home. but there are so many variations that can still target the right muscle groups.
And Kavita has got a question.
Yeah, I have actually two diverse situations of people with ages, one of 78 and the other one is at 20s. 78 is my mother sitting here, and I totally agree with what Dr. Sundar and Mr. Dinesh was telling about my mother finding a little bit difficult to lie down immediately if she wants to, or get up immediately. So she gets a sore back when she is standing for some time in the kitchen, and then she says, I want to go and have a rest. So I was just wondering if those exercises which you showed was the right ones to go about, or is there something else which she should be practicing, especially being 78 years old?
I think it's really hard to determine exactly what is perfect for her, since I only have what you just gave me. But it sounds like if she were to do, does she go for walks and things like that? That might be appropriate for her. If she's getting tired, she can have, like, I think definitely have a rest and do the mobility things, so the stretches and things like that. And then there are plenty of standing exercises or sitting exercises that I would give her to strengthen, so that she can last longer in a standing position. For example, as you said, if she's in the kitchen or something like that. So for your mother, I would lean towards bed exercises or stretches in the bed, and then I would lean towards standing or sitting strengthening exercises, so that we can improve her endurance.
Right. And if I can ask you another question.
Of course.
Who is in her early 20s, and she is currently in her final year of dentistry. For the past 2 years, 4th and 5th year, she is into the looking at patients and everything. So you can understand, as a dentist, I'm sure at some point of time, they're going to have the neck or the back stressing out and a bit of back pains. And recently she said that she went and got a foam roller for her back. I'm not very sure if it is the right way to go about in her young, tender age of when she's just starting. I was just thinking, like, if she's doing the right thing. I totally understand that she is going to be getting some sort of aches when she's practicing in that profession. So is it okay to go with the foam roller, what she is talking about? Just if you can throw some light on it, please.
Can I speak about that?
Yeah, of course.
Yeah, sure. So the foam roller works usually as a coping mechanism for muscle spasm. So if your muscles go into spasm, then you get pain, and you use a foam roller, then you are kind of kneading those muscles and you get pain relief. So it's a good way to do pain relief. But if the muscles are stronger with the exercises which Taylor and Chris or Exercise Physiology will help you with, then those muscles cope better in a posture which is associated with dentistry or with walking. The same with your mother. If the muscles get tired, which is why she gets fatigue pain. So yes, which is why she needs to lie down to take gravity out of the picture. So the exercises Taylor has told you about helps to take the gravity out, but then build up those same muscles which are needed to provide more stability in the standing up position. So there are two things over here which I think are happening. One is to sort out the pain, which is happening because it's fatigue pain. And the second is to treat the muscles so that the stamina of those muscles actually is better. Over to you, Taylor. What do you think?
That's exactly what I was going to say. So the foam, there's nothing wrong with the foam roller. I think she's just starting a new job or doing so much postural work, which is why she's getting sore and tired in the first place. So the foam roller will help with the immediate symptoms, but is not going to last a long time. She'll be foam rolling every single time, every single week. So to prevent the need for the foam roller, postural strengthening is going to be the long-term solution, and the foam roller is the short-term solution. So I would utilize both techniques because they will both help, but the longer-term solution is the postural strengthening.
So when you said the postural strengthening, those are the ones which you showed us today.
Not so much. The postural strengthening will include a lot more upper back and chest and shoulder strengthening rather than so much lower. What I gave was lower lower back, trunk, and lower limb strengthening, assuming that we're speaking mainly about lower back pain. But her one is more upper body postural, so I would include a lot more, upper back strengthening in that scenario.
Right. Okay. Okay.
Do we have any other questions? Taylor, I must say that I go to Pilates and which is a ladies' gym, and haven't gone for COVID for 2 months. We get people from 20 years to 80 years old, and the exercises you showed, most of them, we do it when we do the Pilates.
Yes, definitely.
Even I have had my both knees done. That means people say you can't sit, and I'm able to do at least 85% of the exercises. And so it's, I don't know, that's another way which I found it useful. So I thought I'll just mention in case people want to use that, one of those things.
Yeah, 100%. Pilates is a great tool because it's both mobility and strength. It has a lot of trunk emphasis, core emphasis, and you would have recognized definitely every single exercise that I provided today, you would have recognized because we use some of those techniques and that trunk emphasis at that very base level of training. So at that very base level, we are trying to provide an exercise that most people will be able to cope with. And yeah, they are Pilates derived. So no wonder you knew about them.
So for her, Kavita's daughter, 20-year-old, that's the reason I mentioned from personal. I'm not expert, but from my experience, I thought it might help. Are there any more questions?
Well, I'll just make a point on the previous point, which is, I think you're absolutely right, Mrs. Dougal. It's the muscles that we normally use and we think that we need, young people think about, oh, I need to build up my biceps and my shoulders and my legs and my thighs and my bum and things like that. And I'll go for a run and do these things. The exercises which you do many a time in the gym, which are weight-based exercises, they usually neglect the core. So the core, when you talk about the core is the intricate muscles which keep your spine, which take away the load on your spine. And that's very important. Yeah, I like to tell people that if you imagine a telephone pole, then the wires which are holding the telephone pole are your core muscles, and your spine is the telephone pole, right? Now, the spine by its nature has to be flexible, because you need to bend and do things, which is why the core muscles are actually even more important. And as you grow older, old people go for walks, which is a good thing. It does activate the core somewhat, especially if you keep your tummy tucked in. But as you grow older and you become more stooped and you say, oh, I better take a rest, I've got a bad knee, or I've got a bad hip, or I've got arthritis, you are neglecting your core. And then that becomes a slippery slope. So the core strength is key to keep it as high as possible. And as Taylor said, the more you use your core muscles, the better stability you have, not only in terms of muscle strength and ligament strength, but also your vitamin D. Your osteoporosis is limited because you are stressing your core. So I think that's quite important.
Do we have any more questions, or
you can carry on?
Yeah.
You can carry on.
Yes, Dinesh.
Question asked after 5 minutes questions. After 5 minutes.
Okay. Dinesh, you are.
Yeah, hello. I think that was very, very interesting point, which Dr. Singh mentioned. And I have been participating in a program here in Melbourne, in a local U3A. And there, one of the things they do, one of the courses, they are combining Pilates, chair exercises, wall exercises, and yoga. All these three are tailored for core strengthening. And now I got a bit of problem in that area, and have benefited a great deal, especially, for example, when I cannot lie down, then a version where I do this core strengthening against the wall is I found quite useful. So that way, I think for Kavita ji's mother, that could perhaps be tried as innovation, not innovation really, I should say, something which is tailored for her limitation. And I'm sure she's not alone. I am much younger than that perhaps, but I have sometimes very acute problem. I can't lie down. And, but it is the strengthening, core strengthening really, which is the solution. And I believe that there could be some future in trying to tailor more than one systems to meet somebody's needs.
Thank you.
Correct.
Do we have any more questions? And we thank everyone. I'm going to ask Dr. Valanju, who is our one of the directors, to thank. Before I do, we must give a big thank you to Mubina, who spends a lot of time to create the events and helping us to go live. And to all those people who are here today and support us, please keep supporting us. We'll keep on trying to help you to have the quality of life that we all deserve. And please, before I go, please don't forget on Wednesday, it's a great moment for Asha and for our community that we've got 2 short films made for elder abuse, which are done by our volunteers. And it's in a webinar. We will be sending you the link. Join in. It'll be on our Asha page live as well. And we will try to support our community so that we don't ever have to hear about elder abuse, especially in our community where Ramji went for 14 years just to obey his father. So we come from that kind of background from over there. So please join in that. And thank you to everyone. Dr. Valanju.
Can I just interrupt? Sorry, Bijendra, just sorry to interrupt. I was not sure whether Ms. Taylor finished her presentation.
Yes,
Does she have anything more to give us something? I mean, short.
yes, yes.
I know we might be running short of time, but I wasn't.
No,
sure
we got
that.
enough of time.
Okay, so I thought that Taylor probably may have a bit more for us too.
No, that's all I really had to say. I was more just wanting to give you guys an idea of what exercises you could use, the importance of it. And as long as you know where I'm coming from, then I have nothing more to say.
Can I have one more question, please?
Of course.
I just wanted to know about this back posture belt. I mean, is that a good idea to have, or how does it work?
That's a great question. Are you talking about a brace or
brace?
A brace? Actually, I think Bisham would have more to say on this topic.
Yes, of course. Look, brace wear is useful in the acute setting when you have a lot of pain.
Mm-hmm.
And what you are doing with your brace is you are doing a cheat. You're putting a brace tightly around your tummy and you're increasing the pressure of your abdomen. So essentially you are doing what your core muscles should be doing, which is why it helps. So a brace wear is acceptable and useful in the early stages of acute back pain. But if you use a brace, then you're not using your own muscles and your own muscles become weak very quickly. So I use braces in 2 or 3 settings. I use braces when there is a fracture or an injury and they need to limit the amount of movement. Then I use a brace, or I use a brace in young children who are having a scoliosis when their spine is curved. So you can use a brace and try and help them with that. But in adults, and especially in elder adults, I discourage people from wearing a brace for too long because you are actually making things a little bit worse in the longer term. So if it is that sore that you are having problems without a brace, then it is probably better to see somebody like Chris and Taylor to assess them. And so Chris and Taylor are partners, and they have this wonderful gym which you could see on the screen. And the best part of that, this arrangement with Taylor and Chris, is that they use the gym regularly and they can document the increase or decrease of the ability of people to do what they need to do. So a functional assessment, what can you do? What can't you do? Let's make a baseline. Let's put a make a small goal and let's reach that the next time and keep going forward, which does tell the people, just does tell the patient, it shows them that they're getting better. So yes, in a sense, braces and belts are fantastic when you first use them, but they don't help your spine in the longer term. Yes.
Interesting. Thank you. Thanks for the
Thank
nice wealth of knowledge being shared.
Mr. Taylor, just show the, can you show some simple exercise for the older generations, what we can do to decrease the pain in the back pain in the back?
And also for the neck, is it possible to
Just
give some idea about the neck, the strengthening the neck, especially after we wake up in the morning for the elderly people? Does it,
So are we talking about stiffness in the morning for your neck? Sorry, I didn't.
not only stiffness, but also I can say very painful. It is not stiffness, yeah, quite painful, and which lasts for probably throughout the day.
Okay, I think it's a difficult question to answer, mainly because where's the pain stemming from? So if it's what we like right in the center of the neck through here, or is it more broad out through the shoulder?
Depending on which side I sleep on, it could be either on the left side or on the right side. So depending on what is a longer duration of which side I have slept on the night.
Yeah, so that sounds more muscular in nature up through the upper traps and maybe a little bit lower.
Mm-hmm.
And what I would do in that scenario, there are simple stretches you can do. As we discussed before, the stretches are more to help when the pain is there and it's more of a temporary solution. But I would look at your posture as well. So for the stretches that you could do, for example, when you bring your chin down to the opposite side of your chest, and you just gently hug on the head like that, and you should feel a stretch like back through there.
Mm-hmm.
So this kind of stretch as well will help.
Yeah.
They're very simple ones that you do. You kind of hold those things for about 30 to 40 seconds. I would also do something, I think one of the ladies before spoke about the foam roller. You can also do something similar with a ball, and I would pop that up into the upper traps and massage that area. And that will help with how it feels throughout the day. But if you're wanting to get a long-term solution, I would look at more postural work, similar to the 20-year-old lady who's having soreness in the upper back, some postural strengthening, endurance-based tasks for the neck and the upper shoulders. So something like what we call like a chin tuck. Sorry, it's a little bit difficult to show you over the...
Yeah, I know. Yeah, I understand. Yeah, I think probably I need probably a referral to see you or some other physiologist. Yeah, thank you. Yeah,
no problem.
Yeah.
That's great.
See how you go.
Yeah.
Do we have any more questions or?
Rani, any question?
Is there a question?
Rani wants a question, I think.
Okay.
I think overall in all the questions that you have asked, although it's difficult to give like a specific answer for each scenario, the general principle kind of is still there. So we're trying to teach you how to maintain it on your own. So to give you some active strategies, coping strategies that you can do on your own at any time. And that will be specific depending on what your issue is. So that could be with the foam roller or the massage ball or simple stretches and mobility tasks. And then we also, adjunct to those tasks, we want to strengthen the area to provide a more robust system, and so that we prevent that intensity of symptoms happening again. So we always look to provide as much mobility as possible, provide as much strength as possible to improve your function overall. So those are kind of the things, the base principles that we're looking at every single time. And it usually improves your pain as well.
Before I ask Dr. Valaju, Mubina, who is a nutritionist, and if she wants to add something, Mubina, is she there? Because she she was saying that she can always. Is Mubina there?
No, she is muted. Please, Mubina, unmute.
Mubina?
Mubina, unmute. You are.
Yes, sorry. I
Sorry,
wasn't
yeah.
expecting actually. So,
Yeah.
yes, in terms of back and strengthening muscle, probably enough protein in diet is important, especially for Indian community. Diet is quite protein, sort of insufficient protein in their diet. So there are many ways you can consume protein. If you're vegetarian, so it's like a lentils, soya is a very good source of protein. It is equivalent to meat protein. Increase amount of milk you're drinking. Nuts is also a good source of protein. So you can add all those things, and there's a big list. So you can add all those things in your diet. It's very important because you can work, but if you don't have enough protein in your diet, probably you're not going to build the muscles that Taylor was talking about. So, and also because protein is not only needed to build muscle, but also maintenance of the muscle, as well as many functionality of the body, like hormones and many other things actually needs protein ongoing. So it's very important. This is the one thing we need to really keep an eye on. And in general, when people, as we grow older, our diet actually sort of, our appetites get sort of subsides. So we don't eat as much. So, and that's another reason we start to lose muscles faster than normal. With the age, we do lose muscles, but if the diet is not right, we can lose muscles even faster. So it's very important. What do you think, Taylor?
I think that's a very, very good point. Anecdotally, I find that the people, like when you first start doing strengthening training, especially when you're a novice, it's really hard to recover for some people, and they're quite shocked by how the body feels. It is a bit of a shock to the system. As soon as I ask them about their diet and how much protein they're incorporating, especially the timing of their intake, really helps with muscle recovery. And I find that as soon as we start talking about that kind of subject, they are able to cope a little bit more and recover a little bit better than if their diet is not really assisting with their program. Because it is a big change to start incorporating a strength and endurance program.
Dr. Suddar has got a...
Just say about hydrotherapy, Ms. Taylor, what do you think?
Sorry, what was the question?
Hydrotherapy, yeah.
Oh, hydrotherapy.
That's right.
Yeah, so I utilize hydrotherapy very sparsely, and the reason is because we don't live in water. The way that I use it is, if you're someone that is struggling with weight-bearing activities, we've got, knees and hips that are really, you can't cope with walking or weight-bearing for long periods. Hydrotherapy is a very, very useful tool at the beginning of your rehabilitation to start doing strengthening and endurance, like aerobic program that you might not be able to cope with outside on a land-based program. So it provides buoyancy. It actually really helps with how the back or any joint feels, because it improves the amount of compression in that area. So I really like to use it for people that are struggling too much with a land-based program, with the assumption that once you're in the water for a long period of time and you've done it for a few months, we will try to do a land-based program as well. The one time that I like to use a hydrotherapy program ongoing is if there's like a weight loss component that we need to address. So a hydrotherapy program has been really useful in aerobics work when people are struggling to weight bear, because they can really push themselves in the water without having to worry about all the joints that might be causing an issue. So an aerobic program in the water is good. Strengthening initially is good in the water, and with the assumption we're going to work into a land-based program. Otherwise, we're avoiding things like bone strengthening as well, which a land-based program can provide and a hydrotherapy program cannot.
Thank you, Taylor.
Okay. Sorry. Do you run your gym thing in Norwest?
Yes, we're in Norwest.
I see. Okay. I think I should get my daughter to get in touch with you. She's now in Victoria. She should finish her thing and come back in another few months. I'll ask her to get in touch with you.
Yeah, definitely. Even if she wants to do a Zoom conference, I'm happy to speak to her if she needs some general advice.
Okay. Yeah.
Yes.
Dr. Praful, are you ready?
Yes, I've been ready for a little while. Excuse me.
Sorry about that. No, it's
No,
great that everybody's asking
no,
questions.
It's
And
worth
I think
waiting
we have
for.
more questions, but lack of time.
Well,
no,
this
we
is
have
a very
scheduled the meeting for.
complex issue, and Dr. Singh, Michaela, and Chris, they have done a very great job tackling a very difficult issue in such a short period of time. You see, spine, the stability of the spine, the musculatures, the looking after the various activities of your spine is a very important and very complex subject. And I congratulate Dr. Singh, Michaela, as well as Chris for the demonstration. They have done a great job. Very well done. Thumbs up for you guys. And we are looking forward to more sessions on these, because as Dr. Singh knows and Michaela just said, that it's a subject that is going to need ongoing tackling, and I'm hoping that we will continue with these sort of sessions for a long period of time, and I think that's going to benefit all of us. So thank you very much. And
Thank you.
Thank you very
And
much.
let's give a big clap to Dr. Bishop Singh, Taylor, and the team, and to all of you.
Thank you very much. Thanks, everybody. Thank
you.
you.
We happy Father's Day tomorrow.
And,
Happy Father's Day.
and please, tomorrow morning we have India Link Radio at 10:15. We're talking about the elder abuse. So if you want to hear our voice, I'll be talking, and then from Senior Rights, Diana, who is one of the main officers, is going to talk about that. So I'm sorry to plug in that, but I think it's a great way to give the information. And Dr. Bishop Singh and Taylor and everybody else, we hope to see you again. We will continue. We'll keep on bringing to you whatever you need. If you have any special requests, contact us. We'll try to get for you. Thank you so much. Have a pleasant afternoon, and a big clap to everyone. Thank
Thanks
you.
very much, guys. Thanks for having me.
Thank you, Taylor. We really appreciate it.